Hey everyone, welcome to Smart Course, the go-to place for authoritative information and strategies on special needs, learning disabilities and disorders, especially ADHD. Today I'm here to talk to you about teen-specific risk behaviors and how to deal with it as a parent. Today we're going to talk about 3 key topics that are specific to the teenage era, focusing on driving, alcohol and drug consumption, safe sex and sexual orientation. We also covered tips on parenting teens with ADHD in another video on our channel. So if you enjoyed today's video, don't forget to like and comment and then visit our channel to watch it. And don't forget to hit the like button and subscribe to our channel. We know a lot of people need this information, so share this video with someone you think may need it also. Plus, if you like, subscribe, hit the bell, comment, and sign up for our upcoming summit at this link, then we will pin your comment to the top and we will send you our expert-curated list of ADHD resources. In this video, we'll cover information by esteemed and authoritative resources like Attitude Magazine, the National Institute of Mental Health, chad.org, and understood.org. Okay, so last video we talked about how ADHD manifests in teenagers and how to cope with an ADHD teen as their parent. We mentioned key things to take into consideration as your teen enters these teen years, from IEPs to social pressures, and how ADHD symptoms may affect and influence their teen experiences. But we mentioned very little about teen-specific risk behaviors, and that is today's focus. I will be talking to you today about how to approach the topics of driving, drug and alcohol use, and sex for your ADHD teen. Before we dive into these topics though, let's have a quick recap and chat about how to establish and enforce rules with an ADHD teen, a vital part of raising any teenager. Having a teen means facing resistance and argumentative conversations. Teens are skilled when it comes to testing parent boundaries and rebellious behaviors. So how can you prepare before conversations blow up? With an ADHD teen, crystal clear rules, consequences, and behavior guidelines are essential. You need to make sure everyone is on the same exact page of understanding, so if a behavioral issue does arise, there is little to no room for misunderstanding the consequences. Start by working on setting 4 to 5 clear-cut, non-negotiable rules. For example, the use of any illegal substances, including weed and alcohol, are not at all tolerated in the house, and outline clear set consequences if this rule is broken. You should set these consequences with your teen and negotiate the consequences together. This will help make sure everyone is aware and understands the consequences, as well as allowing them a voice in their own punishments, vital for most teens, especially with ADHD. On the other hand, also set rewards for compliance to these rules, such as extended privileges, longer TV time, better allowance. You all decide together. A key in dealing with ADHD teens is going to lie within catching your teen doing something good and rewarding them for it. Remember, either way, stick to the rules and consequences or rewards you set. Consistency is key. Finally, in creating your rules and guidelines, try to connect the consequences as closely as possible to the troubling behavior. For example, if they were out driving and arrived home after a curfew, relinquish their car key rights. Try to let these negotiated consequences take the place of argument, recrimination, yelling, or nitpicking. Keep the conflicts and emotions out of it. Simply provide the appropriate response to keep family life relatively pleasant and upbeat. Okay, so let's jump into these teen-specific behaviors. Driving. One of the most exciting rites of passage of being a teenager is that gaining independence, and driving is the epitome of teenage independence. But ADHD can be tricky when it comes to learning to drive. With the symptoms of inattention and impulsivity, drivers with ADHD are known to have more tickets, are involved in more accidents, make more impulsive errors, and have slower and more variable reaction times. Stimulant medications have been shown to have a positive effect, however, on driving ability and performance. So this could be something to consider, but as always, talk to your professional before making any of these types of decisions. Just as with anything when parenting a child with ADHD, openly talk to your teen about driving safety, seatbelts, the code, and so on. Especially talk about distractions when driving, from eating to texting and having music playing. As one of your rules with them driving, you should consider restricting the number of individuals that can be in the car whilst your teen is driving. Driving requires focus, concentration, good judgment, and the ability to adapt to sudden and often unpredictable changes in the immediate environment. The younger the driver, the more likely a lack of experience and behavioral immaturity will result in risk-taking behaviors. Some other rules and statements to consider discussing with your teen as they take on the task of learning to drive could be that driving is a privilege, it needs to be earned, and it may be taken away if not respected. If you start stimulant medication and it helps their driving ability, make a rule that it must be taken before taking the wheel. And limit passengers for the first 6 to 12 months of driving, for example, only family members including siblings. Limit rush hour, freeway, and late night driving for the first couple months of driving. Practice with parents to gain the necessary skills for such a high stakes environment. And finally, consider a no cell phone or music car environment. All of these elements provide distraction to an equal degree. Further, explain that hand-free phone use does not bypass these rules and is also dangerous and will not be tolerated. So, they are set and learning to drive. The next teen-specific behavior and rite of passage? Alcohol and drug use, or at least a social pressure and temptation to try these. This is a tough topic for all parents of a teen. It's the key age of experimentation and social pressure. Not a great mix, especially when you have ADHD. So how can you help talk calmly and clearly with your teen? Teens feel an incredible sense of invincibility and immortality, and your explanations of the risks have to truly break through that. As previously stated, you have to be totally clear on your parental expectations so as to provide a strong and necessary foundation, such as a no tolerance policy in the household for alcohol or drug use. You could even measure alcohol levels of bottles you have in the house, leaving no stone unturned, so that your ADHD teen truly understands and sees consequence if rules are broken. Also, know your teen's friends, know their parents, and if rules are broken, do not hesitate to call their parents. Once again, the emphasis is on letting your teen realize the consequences of their behaviors and rule breaking. Don't hesitate to monitor your adolescent's activities and expect resistance. But be strong, it's your role. Final topic, let's talk about sex. Once again, a tough new topic will be talking to your teen about sex, and it's part of the age and this era of their lives. So how can we do it in the most constructive, understanding way? Talking about sex with your ADHD teen is very much a lesson on sexuality, sexual impulses, sex in general, consent, and other key pieces of information that are vital to approaching sex with a healthy mindset. Teach your teen to be honest with themselves about their own sexual impulses and how to act on them in a safe and ethical way. Sexual ethics means talking about pregnancy too. You may need to talk about birth control. Inform them of their options, which may depend also on their sexual orientation. You need to have a frank, safe, supporting conversation so as to not overload them with information and make it as personally applicable to your teen as possible to avoid any chances of confusion. For girls with ADHD, you may want to talk about more long-term options than the pill, as this is something that they must remember to take every day and to be effective. Hard if you're lacking executive function skills. Bear in mind, this topic is probably going to be the toughest. It's an uncomfortable talk for all involved. Not to mention, as a parent, it's a huge shock to the system for some that their child is growing up. Check in with your own emotions before diving into these talks. Remind your child and yourself that at the end of the day, having sex is a personal choice that only they can and should make. You as a parent need to accept that you may not be ready to hear that your teen consented and said yes to having sex. However, you have to push that aside and check in to make sure it was all consensual, that they were comfortable and safe in the situation, etc. Teaching your child to make smart decisions and reflect on what he really or she really wants in sex, in love, and in life will allow them to live at their most authentic self. A mindful approach will be much more effective than simply teaching them to just say no. Also, be aware of two other factors when it comes to having ADHD and having sex. ADHD can have a huge effect on sexual drive, leading to either hypersexuality or hyposexuality. Hypersexuality is when you have an unusually high drive due to the release of endorphins from sexual stimulation. This endorphin release can bring about feelings of calmness and reduce the restlessness of ADHD. Yet mix this with the impulsivity of ADHD, and teens that fall under this category can find themselves engaging in risky sexual practices and situations. On the other hand, hyposexuality is when a person's sex drive plummets. This can be due to ADHD, but also as a side effect of their medication, especially if they are on antidepressants. For people in this category, just as with any other activity they may take part in, they can have trouble concentrating during sex, lose interest in what they're doing, or become distracted. In conclusion, a key part that ties into all these topics we've spoken about is to know how to negotiate with your ADHD. There is a technique called problem-solving training that has clear steps to follow and outlines a great approach to setting rules and consequences with your teen. The steps go like this. Number 1, define the problem and its effects. Come up with a variety of possible solutions. Choose the best solution. Plan how to implement that solution. And renegotiate a new solution if necessary. A good way to begin is by choosing the potential problems that are much easier to set specific rules and are less emotionally intense for you all. So maybe start with alcohol, drugs, then move on to driving, and finally sex. But that is completely up to your discretion. Eventually, you may even become so adept at this rational form of problem solving that you and your team will be able to resolve arguments on the spot, in most cases using informal versions of this technique. In our upcoming video, we will be learning more about teen ADHD in girls versus boys. For an expert-curated list of resources from our past summit and videos, please visit the link in the description. If you enjoyed this video, please don't forget to like it and let us know what you liked or what you'd like to see more of in the comments below. Also, don't forget to subscribe and hit the notification bell. The more people that like, subscribe, click the bell, and comment, the more people will see this kind of content on YouTube, and we know some people could really use the help. So also don't forget to share this with anyone you know who could benefit from this video. We share tons of expert vetted resources on parenting and education for differently abled kids, so feel free to sign up for our newsletter using the link in the description below. If you like, subscribe, hit the bell, comment, and sign up for our upcoming summit at this link, then we will pin your comment to the top and we will send you our expert-curated list of ADHD resources. If you haven't watched our previous series about ADHD and other disorders, click the annotations in the right top corner to watch those videos. If you want to support Smart Course and help make sure we can continue bringing you content, check out our Patreon and membership pages. We also have an online course with even more specific information, step-by-step guides, and access to professionals who can help you through this process. As always, I appreciate you taking the time. Thank you for watching and see you soon.